Let's go to the middle part of the inferior view of skull. The middle part of the inferior surface is made up from sphenoid and temporal bones and sometimes the basic. The basic, which can be called in other words as the basilar part of the occipital bone, is described in the posterior part in our textbooks. So we can think that the middle part extends from the posterior nasal aperture here to the border between the temporal bone and occipital bone. This is occipital bone, so this border, around this border, and probably and roughly these areas can be called as the middle part in our video clip. And as I said, some textbooks, the lateral part of inferior view is separately discussed. Anyway, in the adult, the body of sphenoid bone fuses with the basic, the basilar part of the occipital bone, to form a midline bar of bone that extends posteriorly to the foramen magnum. So in this figure, this is the foramen magnum, and this is the basic, and here is the midline bar of bone that extends to the posterior. Internally, in the cranial fossa, this region can be called clevus. The basic bears a small midline pharyngeal tubercle which gives the attachment to the pharyngeal raphe, the highest attachment of the superior pharyngeal constructor. Here is the pharyngeal tubercle. These structures will be discussed in detail in the posterior part of the inferior view of skull. The Petrous process of the two temporal bones pass from the lateral side of the base of skull and fill the triangular space between the greater wing of sphenoid bone anteriorly in this figure. This is a greater this is the greater wing of sphenoid bone anteriorly, and this is occipital bone. Or the lateral margin of the basic. So in this figure, the pink colored region here is the Petrous part of the Petrous process of temporal bone. Each Petrous process meets the basilar part of the occipital bone at the petro-occipital junction here, which is deficient posteriorly at the jugular foramen. They meet, but there is a deficit in the posterior area, has a hole or foramen here, and this is the jugular foramen. And the petrosphenoidal junction and the groove for pharyngotympanic tube, that is the auditory tube or eustachian tube, lie between the Petrous process and the infratemporal surface of greater wing of the sphenoid. So in this region there is a groove for the auditory tube. The apex of the Petrous process does not meet the spheno-occipital synchondrosis. The spheno-occipital synchondrosis is located here, but the Petrous process of temporal bone does not meet directly with this sphenooccipital synchondrosis, and there is a deficit. There is a deficit is made here. So this hole we call as a Foramen Lacerum. The pterygoid processes descend from the junction between the greater wing and body of the sphenoid bone, separated by a pterygoid fossa. These two plates are the pterygoid plate, pterygoid process of the sphenoid bone, and these two plates are separated by pterygoid fossa. Pterygoid fossa is located here as a green colored area. Anteriorly, the plates are fused except in inferiorly, where they are separated by the pyramidal process of the palatine bone. Pyramidal process of palatine bones can be colored as a pink area. Here is the pyramidal bone, and this is the pyramidal process. Which separates the medial and lateral pterygoid plate at the inferiorly. Sutures are usually discernible at this site in young adult skulls. And laterally, the pterygoid plate are separated from the posterior maxillary surface by pterygomaxillary fissure, as we talked about in the former video clips, which leads into the pterygopalatine fossa. The posterior border of the medial pterygoid plate is sharp and bears a small projection near the midpoint, above which it is curved and attached to the pharyngeal end of the pharyngotympanic tube. Around here, we are now describing, and above the medial pterygoid plate divides to enclose the scaphoid fossa. This pink area is a scaphoid fossa, which means a little ship. Below it projects a slender pterygoid heaviness which curves laterally and is grooved anteriorly by the tendon of the Tensor palatini. Here in medial plate's lower point, we can see the pterygoid heaviness. The pterygoid heaviness gives origin to the pterygomandibular raphe. The lateral pterygoid plate projects posterolaterally, and its lateral surface forms the medial wall of the infratemporal fossa. Superiorly and laterally, the pterygoid process is continuous with the infratemporal surface of the greater wing of the sphenoid bone, which forms part of the roof of the infratemporal fossa. This surface forms the posterolateral border of the inferior orbital fissure and bears an infratemporal crest associated with the origin of the upper part of the lateral pterygoid. This is the inferior orbital fissure, which is formed by the maxilla and palatine bone and zygomatic bone's greater wings. The infraorbital and zygomatic branches of the maxillary nerve and accompanying vessels pass through this inferior orbital fissure. Laterally, the greater wing of the sphenoid bone articulates with the squamous part of the temporal bone here, and this is the squamous part of the temporal bone. The medial aspect of the greater wing of sphenoid presents a crescent of the foramina, of which only the most posterior to the foramen ovale and foramen spinosum can be viewed from this inferior aspect. This is the foramen ovale, And this is the foramen spinosum. The foramen ovale lies medial to the foramen spinosum and lateral to the foramen lacerum on the infratemporal surface of the greater wing of sphenoid bone. It transmits the mandibular division of the trigeminal nerve, lesser petrosal nerve, and the accessory meningeal branch of the maxillary artery, and in addition, an emissary vein that connects the cavernous venous sinus to the pterygoid venous plexus in the infratemporal fossa. Posterolaterally, the smaller and rounder foramen spinosum transmits the middle meningeal artery and the recurrent meningeal branch of the mandibular nerve. The medial surface of the spine is flat, and with the adjoining posterior border of greater wing of sphenoid forms the anterolateral wall of the groove that is completed posterior medially by the petrous part of the temporal bone. This groove contains the cartilaginous pharyngotympanic tube, which lays posterolaterally into the bony portion of the tube that lies within the petrous part of the temporal bone. Here is the groove for auditory tube or pharyngotympanic tube. Occasionally, the foramen ovale and foramen spinosum are confluent, or the posterior edge of the foramen spinosum may be defective. A small foramen, a sphenoidal emissary foramen, which can be called as the foramen vesalius, is sometimes found between the foramen ovale and scaphoid fossa. As I said, this is the scaphoid fossa in pink color. When present, it contains an emissary vein linking the pterygoid venous plexus in the infratemporal fossa with the cavernous sinus in the middle cranial fossa. The foramen lacerum is bounded in front by the body and adjoining roots of the pterygoid process and greater wing of the sphenoid bone, posterolaterally by the apex of the petrous part of the temporal bone, and medially by the basilar part of the occipital bone. Although nearly 1 centimeter long, it is not traversed by any major structures. The almost circular carotid canal lies behind, probably inside of the petrous part of the temporal bone, and posterolaterally to the foramen lacerum in the petrous part of the temporal bone. The internal carotid artery enters the skull through this foramen, ascends in the carotid canal, and turns anteromedially to reach the posterior wall of the foramen lacerum. It ascends through the upper end of the foramen lacerum and accompanied by the venous and the sympathetic nerve plexuses. This is the external orifice of the carotid canal and internal orifice of the carotid canal. So the internal carotid artery runs this direction, and around the foramen lacerum, it enters in the middle cranial fossa. Meningeal branches of the ascending pharyngeal artery and the emissary vein from the cavernous sinus also traverse the foramen lacerum. In life, the lower part of the foramen lacerum is partially occluded by the cartilaginous remnants of the embryological chondrocranium. The pterygoid canal can be seen on the base of skull at the anterior margin of the foramen lacerum. This is the pterygoid canal in this figure. Above and between the pterygoid plates on the sphenoid bone. It leads into the pterygopalatine fossa and transmits the nerve of pterygoid canal and accompanying blood vessels.